everyone. I am a volunteer with For a Safer Space. Today's presentation is about post-traumatic stress disorder. I would like to begin this presentation with a land acknowledgement. And this is for Toronto, where the Dish with One Spoon territory is located, as well as Toronto Metropolitan University. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into the treaty in the spirit of peace, friendship, and respect. Today's agenda will include an introduction about post-traumatic stress disorder, followed by the symptoms of PTSD, risk factors, resilience factors, treatment options, and lastly, the conclusion. What is post-traumatic stress disorder? PTSD is a mental health condition that can occur after experiencing or witnessing a traumatic event. This event could have been emotionally, physically, or life-threatening to the individual, resulting in flashbacks, nightmares, severe anxiety, and uncontrollable thoughts that lasted for a long time after the event had ended. Natural disasters, serious accidents, terrorist attacks, war combat, rape, sexual assault, historical trauma, intimate partner violence, and bullying are all examples of traumatic events. People suffering from PTSD may avoid situations or people who remind them of the traumatic event, and innocent things such as a loud noise or an unintentional touch can trigger strong negative reactions. PTSD symptoms usually appear within 3 months of the event. However, in some cases, they do not begin until years later. The illness's severity and duration can vary. One of the symptoms are reliving. People with PTSD repeatedly relive the trauma through their thoughts and memories of it. Flashbacks, hallucinations, and nightmares are examples of these. They may also feel distressed when certain things, such as the anniversary date of the event, remind them of the trauma. Another symptom is negative cognitions and mood. This refers to thoughts and feelings about blame, estrangement, and memories of the traumatic event. Increased arousal. These include excessive emotions, problems relating to others, including feeling or showing affection, difficulty falling or staying asleep, irritability, outbursts of anger, difficulty concentrating, and being jumpy or easily startled. The person may also suffer physical symptoms such as increased blood pressure and heart rate, rapid breathing, muscle tension, nausea, and diarrhea. And avoidance. The person may avoid people, places, thoughts, or situations that remind the person of the trauma. This can result in feelings of detachment and isolation from family and friends, as well as a loss of interest in previously enjoyed activities. Risk factors. A person of any age can develop PTSD. According to the National Center for PTSD, approximately 7 or 8 people out of every 100 will suffer from PTSD at some point in their lives. Women are more likely than men to develop PTSD, and genes may predispose some people to develop PTSD. PTSD risk factors include living through dangerous events and traumas, getting hurt, seeing another person hurt or seeing a dead body, childhood trauma, feeling horror, helplessness, or extreme fear, having little or no social support after the event, dealing with extra stress after the event, such as the loss of a loved one, pain and injury, a loss of a job or home, and having a history of mental illness or substance abuse. Resilience factors. The following resilience factors may reduce the likelihood of developing PTSD. Seeking help from friends, family, and support groups, learning to feel okay with one's actions in response to a traumatic event, having a coping strategy in place to help you get through and learn from a traumatic event, and being ready for and capable of responding to distressing events as they occur, despite feelings of fear. Treatment. Getting effective treatment after PTSD symptoms develop can help reduce symptoms and improve function. The main treatments are psychotherapy, medications, or both. Psychotherapy. Mental health professionals use a range of treatment methods, including psychotherapy, to assist patients in identifying and altering distressing feelings, thoughts, and behaviors. People with PTSD and their families can receive support, information, and direction from psychotherapy. This kind of therapy can take place one-on-one or in a group setting, and it typically lasts 6 to 12 weeks, though it can last longer. One common type of psychotherapy, called cognitive behavioral therapy, can include exposure therapy and cognitive restructuring. Number 1, by gradually exposing patients in a safe manner to the trauma they experienced, exposure therapy helps patients learn to control their fear. Number 2, cognitive restructuring assists people in making sense of traumatic events. And then the second option of treatment is medication. The most researched type of medication for treating PTSD is an antidepressant known as selective serotonin reuptake inhibitors. This antidepressant may help control PTSD symptoms such as sadness, worry, anger, and feeling emotionally numb. Now we'll go over resources. The most important thing to take away from this video is that there's supports and help available. For an immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you'd like to reach out for support. That concludes the presentation on post-traumatic stress disorder. Thank you for watching.